Just gonna go for this. All right. Hi guys, my name is Bella Kondo. I'm a senior at Forsyth Central High School, and I've been interning at Northside Hospital's endovascular operating room. And my essential question that I kind of went through my internship with was, how can a hybrid endovascular operating room individualize procedures and optimize patient care? So again, a little bit about me. This is the team I work with every Thursday for at least 3 hours. I'm a senior here. I'm in the STEM program, specifically in the biotech. And my mentor, his name is Mr. Snyder. He is the manager of the endovascular operating room. I met him while doing 3D printing stuff. I was 3D printing aneurysms for him. And we just got to talking, and I talked about internships, and he offered me a position in his operating room. And so I get to work with their entire team, and my whole focus was, what's so special about a hybrid operating room? So my kind of day-to-day thing, I go in on Thursdays, I watch surgeries almost every single day, and I'm usually with Dr. Siddharth Patel, and Dr. Patel is the longest surgeon at Northside. He does endovascular cases and open cases, and he's really informative. He went to Vandy and then to Emory, and he's really been working to just educate me, and he'll talk to me while he's doing surgeries and explain what he's doing and why he's doing it compared to other ways about going about treating a patient. So what I knew before my internship, I really knew very little. I was actually, the only thing I knew was basic vessel anatomy and stuff about aneurysms from the prints I was doing. Aneurysms form when you have an artery or a vessel, and they're usually arteries because of the higher pressure, and you'll have a thin part in your wall, in your lining of the artery, and the blood will expand it like a balloon almost. And the problem with that is, like a balloon, as it expands, the walls get thinner and thinner until eventually it will rupture, causing blood loss and ultimately death if it's not treated or caught. So I went in and I thought that was all they did, and that's all they did every day. But I found that's actually just kind of a part of what they do. And fixing an aneurysm isn't necessarily cutting open a person's stomach and going all the way down and suturing it together and fixing it. There are multiple ways to fix almost every pathology they see. And so the surge. So a hybrid endovascular operating room. It treats two different kinds of cases. You have open cases and you have endovascular cases. Open cases are exactly what they sound like. They're what you think of when you think of a traditional surgery. It's when you cut open a patient, you go down, you fix what needs to be fixed, you come back up and you suture it. Endovascular cases are kind of what you see. They kind of look fancier, where there's a lot of wires and catheters. I've seen a couple cases where they use the cameras and go in. And that's kind of what makes the operating room so special and so unique, is that you can do both of these, because it connects an interventional radiology suite, which is essentially endovascular cases, and a typical surgical suite, which is your open cases. And putting it together is important, and it's better for the patient, because when you do this, you're not constantly transferring a patient between an open operating room and an interventional radiology suite. So if something happens and you're on the table and you're doing an endovascular case, and then something goes wrong and the patient starts bleeding out or something, you can cut down really fast and get there and stop the bleed. And it ultimately improves outcomes for the patient, and it's safer, and it lowers the risk of infection. And a typical endovascular suite costs around $3 to $4 million. It's equipped with a C-arm capable of fluoroscopy and ultrasound. It's stocked with stents, bypass grafts, and other equipment vital to vascular procedures. And one of the biggest things here is sterility, because these rooms are really big compared to a general suite. And so just keeping everything sterile, keeping everything clean. And so what I was able to do, essentially, my first day I walked in, he's like, "Do you want to go back there?" And I was like, on my first day, he's like, "Yeah." So he just went in, he got me scrubbed in, and he brought me in the room, and he was like, your only rules are don't touch the blue, and if you faint, faint away from the table. And so I was given a lot of freedom. I was given my own stool to stand on. And so I stood over and I watched these procedures, and I stood there silent at first, because I didn't think that I was allowed to talk. I thought I was supposed to be neither heard nor seen, just there. But then Dr. Patel was just kind of like, "Hey, do you have any questions? Do you know what's going on?" And I was honest with him. I was like, "No, I really don't." And he kind of walked me through it. and like taught me all about these different procedures and how what they're doing is so much more advanced than 10 years ago, and how patients are leaving in days or hours after their surgery instead of weeks or months. And so this is some of the data that you'll see for aortic aneurysms, actually what I was working on. And so if you go into a surgery with an aneurysm and you present, you can either get an endovascular, which is when they put in a stent, or they can open you up and do a bypass graft. So if you're getting an open surgery, it's about 4 hours. If you're doing an endovascular, it's only 3. But that's only an hour difference, which doesn't seem like a lot, but that's an hour less that you're under anesthesia. That's an hour less that you're bleeding out. It means a lot when it's coming down to your life. You don't need blood transfusions if you get an endovascular usually. And then additionally, your stay, if you get an endovascular, it's 1 day. But if you're in if you have an open procedure, you're in the ICU for 4 days, and then you're in the hospital for a couple weeks afterwards. And then the other big improvement of an endovascular suite is that there were multiple patients that were they had these extremely large aneurysms, but they were old or they were diabetic and they were sick, and they would not be able to survive the surgery because of the harsh anesthesia. But if you do an endovascular case, you put them under local anesthesia, so they're not asleep during this procedure, and so they're able to get operated on and fixed. And people that essentially had a death sentence 10 years ago today can survive. And the other big component of the endovascular suite is the team in it. When you think medical care, you usually think it's cutthroat, it's everyone's trying to beat out everyone else, but it really can't be like that in a surgical room, because you have to put the patient first and think about what you're going to do for the patient. So when they're looking for a team, I interviewed with Mr. Steiner. I talked to him. I'm like, what do you look for? And instead of being like, oh, they're smart, they have the credentials, they have the degrees, he's like, they have grit. They want to go out, they want to be better. And at the end of the day, no matter how hard it was, they're going to sit down and they're going to be okay, and they're going to come in the next day and do their job. And they learn from their failures. They're not stubborn. They sit down at the end of every day and they debrief every single case, and they talk about how they could have done better and what they did well. And so what I discovered is what's so special about the suite is there's the obvious technical advantage. You're decreasing the time a patient has to stay in the hospital. You're increasing their satisfaction. You're just making them feel better about the whole procedure. But beyond that, there's the team that's there to help them and guide them, and just be there in a way that you couldn't previously, because you were just a patient and constantly getting moved, or otherwise just kind of being put away until their next surgery or their next doctor visit. So that's been my past year, essentially, in the hospital.